This weekend we're giving an opportunity to Londoners to come and hear from doctors themselves the concerns they have about the new proposed contract, to hear from us why we think it's dangerous for them as users of the NHS.
Why are you angry about these potential changes to your contracts?
The changes to the contract are huge, and nobody's denying that a new contract would be ideal. Unfortunately, the way in which the government have gone about trying to make this contract happen is to impose a large degree of it. We want to have a negotiation. Mr Hunt keeps saying that we're refusing, but actually we're desperate to negotiate these contracts. Unfortunately, that needs to be a negotiation without preconditions. It needs to be a negotiation and not an imposition, and the government is not giving us that. And ultimately, we think this is going to harm patient safety.
That said, we've been in touch with the Department of Health this lunchtime. Here's what they had to say. Last week, we put out a firm offer that protects the pay of every doctor working legal hours while actually increasing pay for the vast majority. It will reduce the maximum numbers of hours a doctor can work in a week and will improve patient safety as a result. This has been recognised by NHS and medical leaders who called on the BMA to return to talks. Strike action always puts patients at risk, so this blinkered and persistent refusal by the BMA to engage with the government is extremely disappointing. What do you make of that?
Well, the first thing to say is that the BMA aren't refusing to engage. The BMA would like negotiations, as would every doctor. No doctor wants to strike. But the government aren't offering negotiations. They're saying that the contractual points are non-negotiable. Back to what the Secretary of State of Health said last week. Well, he might be saying nice things like they're going to reduce the number of hours junior doctors are working, but what they're actually doing is removing all of the safeguards that currently exist in our contract to prevent us working long hours. And what doctors fear is that will lead us to working the 100-hour weeks we saw at the end of the last century that led to tired doctors and eventually harm to patients. And that is the most important thing on this contract. And that's why we want to go out and meet Londoners this weekend to tell them, to explain why this contract's dangerous.
Talking of harm to patients, aren't you concerned that by going on strike that you're potentially putting patients at harm?
There's, of course, a concern about going on strike, and none of us want to go on strike. But unfortunately, when you're up against a government who are refusing to speak to you and who are spinning lots of ideas very, very hard to the public, the only way that we're managing to persuade them is to threaten them with a strike. We should also add, it hasn't officially been decided. We're still waiting for the ballot to come through. But yes, we don't want to strike. We know that our consultant colleagues will support in a strike action if that happens. But unfortunately, unless the government is willing to come to us and have a proper open negotiation without preconditions, that may well be our only option.
Tell us when and where your plans this weekend are taking place. How can Londoners find out more?
So we'll be outside Tooting Broadway station from about 10 o'clock in the morning right through the afternoon. There'll be 4 or 5 doctors there at any one time. And this is being reflected across the capital all weekend and indeed across the country. There's a hashtag Meet the Doctors and more information can be found searching for that term online.
And that's on Sunday?
On Saturday, we'll be there 10 till 4, but there are more events going on Saturday and Sunday throughout the capital, that's right.